Standard 4.5 requires the cancer program to review the quality of patient care related to a CoC Quality Improvement Measure and use the CoC Quality Reporting Tools to develop the required studies. This is done each year. The resulting performance level must meet or exceed the required percentage rate. A performance level below that required is addressed with an action plan for improvement. A quality measure is defined as one that can demonstrate good practice, but is not based on clinical trial evidence. Yearly, a report of this activity is documented in Cancer Committee minutes. Cancer Committee discusses the results of the review and focuses on any improvements that may be needed to meet the standard. For programs surveyed in 2013, there is one quality measure that will be assessed for compliance. Consult the NCDB CP3R pages for subsequent survey year requirements. The importance of this standard becomes clear when the facility uses this information to monitor patterns of care, guide practice change when needed, and promote clinical management in the multidisciplinary setting. The attainment of high-quality cancer care is the goal. Meeting the standard involves the work of the CTR, CLP, and Quality Improvement Coordinator. The performance level for the specific quality measure is determined and an action plan devised, if needed, with input from Cancer Committee. All activity related to this work is documented yearly in Cancer Committee minutes. To receive a compliance rating, the program will review the performance level of the QI measure for the required studies, use the CoC tools, report to Cancer Committee on the activity, document the report in Cancer Committee minutes, and devise an action plan if performance levels fall below the CoC specified percentage rates. Documentation begins with the SAR. The CoC will apply a provisional rating from information entered into the SAR based on current data in the reporting tools. The surveyor will review annual documentation that demonstrates the program used the CoC Quality Reporting Tools, monitored patient care using those tools, reported to Cancer Committee, and implemented an action plan to improve performance levels if needed. A provisional rating can be revised. Best practices for meeting the standard should include multidisciplinary discussions within Cancer Committee on any improvements that may be needed. The CLP must report on NCDB data quarterly. This is an opportunity to keep this topic current. CTRs utilizing the RQRS system can help eliminate performance level barriers early by reviewing monthly alerts, thus improving patient care. Thank you for viewing this video on the CoC standards, and remember to view the remaining videos in this series to further increase your knowledge on the standards. For additional resources, be sure to visit the CoC website at www.facs.org/cancer to access the CoC Educational Portal, Best Practices Repository, and Cancer Forum.